Hello, I'm Sudip Ghosh, and it gives me great pleasure to introduce to you my friend of many years and colleague, Alan Park.
Thank you, Sudip. Sudip and I are both consultant plastic surgeons based in the Midlands and southeast of England. We both trained in the UK, and through that training we met about 20 years ago.
I did medicine in India, after which I did general surgery, for which I have a MS degree in. Following that, I did plastic surgery in India too, when I did a lot of head and neck cancer at the Tata Memorial Hospital in Bombay. I then came to Britain, and I have done extensive training in plastic surgery since being in Britain since 1994. My initial experience in plastic surgery was in Edinburgh. That's where I met Alan. And I've gone on to training in Cambridge, where again Alan and me trained together, and then we had our individual career pathways. I've trained in the Norfolk and Norwich University Hospital. I've trained in the Broomfield Hospital in Chelmsford, and I've also gone abroad and done some training in Okayama in Japan and in Ghent in Belgium.
I trained to be a doctor in Glasgow, finishing in 1988, and thereafter finished my surgical training in Edinburgh and Newcastle, then going back to Edinburgh to start my plastic surgery career. I also did some research in breast implants during that time, and that's when I met Sudip. And then I went off to Cambridge for 2 years, and again Sudip joined me there. Following that, I went off to do specialist registrar training in the Midlands and took a year out to go to Toronto to do some microsurgery. We are both fully accredited plastic surgeons, which means that we're on the specialist register for plastic surgery and that we hold the FRCS plastic surgery exam. Not every cosmetic surgeon in the country has this exam, and it shows that we have been appropriately trained.
We are experienced and we are fairly old, which being old is not a criteria to be good, but I think age itself gives a lot of gravitas and a lot of experience, which does not come without years that you have in plastic surgery, which both Alan and me have. The other thing that both of us have been involved with is running and holding various international meetings.
We're also both dedicated to training, and both of us have specialist registrars under us in the NHS, and in addition to that I'm chairman of the West Midlands Cosmetic Fellowship. So I think it's extremely important that we train the next generation of plastic surgeons properly. Currently there are a lot of plastic surgeons or surgeons in this country operating without the proper training. And it's very important that we as plastic surgeons train the next generation. We're just a small team, Sudip and I and the secretarial staff. There are no salespeople involved, there are no nursing staff that will take over some of your care or manage your patients. The management will be consultant led from start to finish.
I think that's the key to our practice, that you see Mr. Park or myself and you get operated by Mr. Park or myself, and we are responsible for all your care before surgery, during surgery and after surgery, and we endeavour to provide a level of service that exceeds most practices in this country.
And I think between the two of us we cover just about every subspecialty in plastic surgery. I have a particular interest in breast reconstruction following cancer, as well as cosmetic breast surgery, and with Sudip's experience of burns and facial surgery, I think we complement each other very well. I like to think that we reduce the anxiety of patients by giving them plenty of time during the consultation. I think most patients get at least half an hour, and if they need another consultation, then so be it. During these consultations we will discuss the benefits as well as the risks of the procedures, and show patients, previous patients, photographs of before and after, showing realistic outcomes, showing scars, and real results.
I think another key to Alan and my practice is that at no stage till the day of surgery do patients commit themselves to pay for their surgery. So at each stage in their consultation process, at each stage prior to surgery, patients, if they have any specific doubts, they're encouraged to come and see either Alan or me, or indeed cancel their surgery. That's fine too, because we believe an informed patient who's happy is a better patient, both for the patient and ourselves.
And if they do get complications, then we will be there to look after them afterwards at no extra cost, and we will be there until everything is healed and the patient is happy. And I think it's important that the patients are not afraid to ask how many procedures we have done. If we're offended, it means that you've something to hide. So please feel free to ask how many we've done, ask for photographs, and ask for evidence.
I think being scared is very normal, and one should be scared when they come and see their doctor for any surgery. Cosmetic surgery is no different, and I believe that to understand the risk-benefit ratio of any surgery itself puts the patient in a higher plane than the average patient, because the patient takes on board the fact that there are some risks associated with surgery, and the fact that the benefits that they accrue following surgery far outweigh these. And I think that is the key to our practice, to give a realistic benefit ratio to help them on.
I'd like to think we put patients at ease, mainly through giving them enough time during the consultation. I think you need to give at least half an hour, and even then a lot of patients have to come back for another consultation at no extra cost, I'd like to add. Just to go back over some of the fears they may have, some questions that they forgot to ask at the initial consultation. We also show before and after photographs of previous patients of ours, which will give them an idea what scars will look like, what sort of realistic results they may expect. As a member of the BAAPS, we are obliged to return an annual safety audit, which encompasses all of the previous year's procedures, including complications and any returns to theatres, infections, etc. I think that's a very important aspect for patients to realise that we are self-regulating.
Alan and my practice is very specific, because not all patients that we see actually we feel appropriate to have surgery. In fact, last year, about 1 in 6 patients that I saw, I had to turn away because I felt I was unable to match their expectations. And indeed, that is the case both for Alan's practice and my practice. If you are unable to match your expectations, we do not operate on you.
When a patient makes an appointment to see me at the hospital, she or he will make an appointment through my secretary, and they will be booked into a time that's convenient for them at a location that is convenient as well. They'll be given at least 30 minutes consultation, and they will see me in the clinic, and I will go through the whole history, examination, discuss all the options available, as well as showing photographs before and after. And then give them time to decide whether or not they want to go ahead, and then they can phone back to my same secretary to make that appointment for the operation. We also do it in a very safe environment. The both of us operate from BMI hospitals, Spire hospitals, Nuffield hospitals, all well recognised private hospital groups in this country with very good safety records.